All right. Good Monday morning. Looks like we've got a slide in front of us that talks about SCORE, Women in Business, always a good thing to support. But I am Paula Chrysler with Healthy Savannah and the Executive Director and the Project Director for a big grant that we have received in association with the YMCA of Coastal Georgia called REACH, Racial and Ethnic Approaches to Community Health. And we have the full team here from the grant and beyond, and we're so excited to be talking about. It's a 5-year grant, and as the title implies, we are working in Chatham County with Black population in underserved areas and trying to make the healthy choice the easy choice surrounding 4 really key strategies: nutrition, physical activity, what's called community clinical linkages. You're going to hear about all of these in some detail in just a minute. And also, most recently, additional funding from the CDC has been provided for COVID and flu vaccine acceptance, access, and awareness. So we're excited to have the team. I'm just going to ask each member, and I'm just going to call out your name, just do a quick introduction, and then we're going to get into the details of what we call year 4 of the grant that starts October 1st and go on from there. So with that, Ashley.
Good morning, everyone. I'm Ashley Range. I am the Director of Fund Development and Communications for Healthy Savannah.
All right, thank you. Armand.
Good morning. My name is Armand Turner. I'm the Physical Activity Program Manager for the Racial and Ethnic Approaches to Community Health Grant.
All right, Nichelle.
Good morning. I'm Communication Manager for the COVID and Flu Grant.
And Dr. Smalls.
Good morning, everyone. I'm Elsie Smalls. I'm the Operations Manager for COVID-19 and Flu Supplemental Grant.
Thank you. Ruby.
Good morning. My name is Ruby Hallam, and I focus on the nutrition strategy for the REACH grant.
And of course, last but not least is Larson Ashford.
Good morning, everyone. My name is Larson Ashford, and I'm the Communications and Community Clinical Linkages Manager.
And we're excited to say, too, that he is working on his master's at Savannah State and has actually been recruited to extend his basketball career there. So we've all put on notice we're going to go find a game to watch him play at some point in the future. So again, it's a great team to have. And what we're going to do is go through each of the strategies real quick. We had a key stakeholder meeting on Friday, September the 10th, and talked about what year 3 brought forward and some of our accomplishments which were significant. But what's more important is how are we going to have what we call courageous conversations into year 4, and what does that mean? And so each of the strategies broke out into small groups and came back with some information, but we're going to try to hold this community headline show to a 30-minute schedule and work from there. So with that, I'm going to turn it over. There you go. It's the breakouts. That's what we had right there. So the next slide is going to show the nutrition strategy group. And Ruby, I'm going to just turn it over to you and just provide the audience with what you've found the highlights as what will success in year 4 look like for nutrition.
Yeah, thank you, Paula. So as Paula was saying, we did have some really great conversation. And the nutrition strategy is kind of large. So we have 2 slides that show the information that we discussed. But some of the main things that came out of those conversations were, how can we continue engaging with the community when we still have to face COVID-19? And how can we do that effectively, but still engage all of those stakeholders and community members in a meaningful way that's going to be beneficial to them? Also, we really talked about how we want to continue moving forward in each of the areas that we focus on, for example, breastfeeding or Farm Truck 9102 and food access. And how can we continue moving forward in that space to really make meaningful change in the long term for community members? And then another thing was just how can we collaborate all together, whether that be across strategies or within nutrition partners? How can all of us collaborate together to really make those meaningful connections and continue to move forward? So that's kind of what we had for nutrition. Were you going to say something, Paula?
Yes, I was going to ask you, so for the audience, what does Farm Truck 912 stand for?
Yeah, so Farm Truck 912 is the Forsyth Farmers Market food truck. So they have the stationary location at Forsyth Farmers Market on a Saturday, but they also have multiple locations across the city that allow food to be taken to neighborhoods that may not otherwise have access to fresh produce. And one of the best things about the farm truck is that if you are an individual that maybe utilizes SNAP benefits or EBT or some kind of food assistance, they'll be able to double those benefits for you. So every $1 spent is another $1 that the farm truck will give to you. So it kind of doubles the amount of fresh produce you're able to get. And they're all quality produce, which is what we're really looking for.
Team members, you have any questions or comments for Ruby and her recap there? All right, Ruby, looks like you did a great job. You're going to keep us moving along. And Armand, my apologies. I had already flipped my my cheat sheet here in front of me to nutrition for some reason. So if we can bring up the physical activity strategy sheet, and then look at that. Wow, look at all that. So Armand, I know you're going to have a few words to say about this. Go ahead, go right ahead.
Yeah, so we also had a really good conversation. We had partners and stakeholders from our friends to Tied to Town board, as well as Bike Walk Savannah, and we had Nick Deffley from the city Office of Sustainability. So we had a really good diverse discussion about physical activity. And I say one of the coolest things that came out was from sort of a broad perspective. Laura Bollock kind of equated our work in year 4 to, she said, like a race around a track. And she basically said that we're at the 3/4 mark of the race, which is usually the hardest part of a race. If you ever ran the 400 meters in track and field, and it's the point where you no longer have that, just getting started energy, but you don't have all that momentum at the end where you're excited about reaching your final goal. So we're kind of right in that little spot where it's kind of a slugfest. And so success for us would really just be us getting over that hump and pushing through that. So from a broad perspective, I think that kind of applies to the entire grant, not just physical activity. But more specifically, some of the things we talked about as far as success is just continued implementation of trails and bike routes here in Savannah. So with the Tied to Town Trail, as many of you may know, that's the 30-mile walking and biking trail network we want to see built for the city of Savannah. But we've already had some phases put into the ground. And so the Truman Linear Park Trail phase 1 has already been put in. And so success for year 2 would be an announcement or groundbreaking on phase 2 of that trail. And so that would go from about Jenkins High School up to Daffin Park. And so that'd be great. And speaking of Daffin Park, success would also look like the Police Memorial Trail, which is right by that, getting a ribbon cutting date, which could happen in October or November or sometime soon. So that'd be a great sort of thumbs up moment for us if we could get that early on in year 4. And what else? So one of the other things, like I said, we had Nick Deffley in our group, and he's from the Office of Sustainability. And so that was something that came up. How can we really change not change, but add on to our conversation around physical activity about how it also provides clean air, and, anything doing with active transportation is a little bit better for the environment than all of us using cars. So how can we bring that to our conversations and all of our discussions around physical activity and active transportation going forward? And I said the last thing I want to bring up that we talked about that I think is really important, Paula, is how can we really sort of change the perspective of whether it's our local government officials or just our general public about what these trails and bike routes really mean. To a lot of people, it sort of serves as recreation and sometimes even just exercise, but it can be so much more than that. We want to bring this type of infrastructure to our communities because we know it provides routes to everyday destinations. So church, the grocery store, work, school, these type of infrastructures and bike routes and separated, protected bike lanes, they provide a safe way for our community to get to those places in which they're already going, but to do so a lot more safely.
Yeah. Excellent recap there, Armand. Team, you want to have any questions or comments for Armand?
The only thing I was gonna say was, I think someone said at the key stakeholder meeting that those bike-in, walk-in, run-in trails need to be not so much a nicety, but they're a necessity for our community and something that we really need. So.
Exactly, and that's how we got to talk about them going forward. Because if we don't, I don't think people would really get the full scope of what they can be. So if we change that discussion to something that's just as critical as any other thing we put our money towards, then I think we can make some great progress.
Hey, Armand, you were talking about October as a possible date, ribbon cutting date. Whatever October that is, it would be great if we could sort of kind of overlap the flu vaccination. Perhaps we have a flu vaccination clinic at the ribbon cutting. Would that be this October or next?
That would be awesome, first of all. That sounds like a great idea, Nichelle. But we're thinking about this October. So we've been out there just a little bit. It's not officially open yet, but you can see a lot of the progress that's been made. And it basically almost looks ready to go. So I'm sure they got a few more things they got to handle. But it should be this October, I'd say. I'm not a professional, though.
Yeah, you are.
Yes, I agree, Nichelle. Yes. And so I've been out on it. And hey, Lindsay, thanks for your comments there. And, you've been working with us for a long time, and so grateful for, your support. And, we're in support of what your next position looks like. I know that your work with Beyond the Bell has had to come to a close, but anyway, we're excited about having you on board. And I should do a shout out. I did see our board chair, Lillian Grant Baptiste, give us a shout out. Good morning. And then also our board member, Jonathan Winbush. So we're excited to have you guys with us this morning. Thank you. So Armand, I just real briefly, so tomorrow morning you were talking about the Truman Linear Park Trail. And so I believe our Healthy Walk, which is 7:30 every Tuesday morning, we're going to, where are we going to meet at Lake Mayer?
Yeah, so we'll be doing the Truman Linear Park Trail tomorrow for our Healthy Walk at 7:30. I was thinking that we can meet at Carver Bank and
that's right.
on the trail and walk towards Lake Mayer. So
okay. I like that. Cool. All right. Sound good. So Carver State Bank, they're at Eisenhower and Skidaway in the parking lot, 7:30. That's when we start walking. So be there early. So thank you, Armand. All right. And next up is Larson with Community Clinical Linkages.
Good morning, everyone. I feel kind of like a movie star on here with all this water cooler stuff, like I'm on the news or something.
You are.
Yeah.
Just say hey to the community out there that's listening.
Hello. Mom, I made it. Basically for CCL, in our breakout groups, the overarching theme was really being mindful to the community and the things that they're going through. So being mindful of the chronic stress, to do with health, low health communities and people living in poverty, and as well as, COVID, which has added an extra layer to that stress. So being mindful of them, making sure that when we are reaching out to these communities and when we are contacting these people in these communities, that we understand to the best of our ability what they're going through, and to try to make it as easy as possible on them to not have to worry about certain things or certain information and try to get it out of us. So just being mindful, trying to also train ourselves on how to be better over Zoom and communicate with people over Zoom, because that is a very different aspect than face-to-face, because you kind of lose that personability when you're over the screen. So trying to be as empathetic over the screen. And another thing, maximizing our Hero Help Me database was really important and is a really good, big success factor for year 4. Focus on training our agencies on how they could teach people to use the Hero Help Me database and get the information that they need concerning breastfeeding, healthy nutrition, and things like that. And also moving forward with the CIE, which is a community information exchange. And we actually have a meeting tomorrow about this. We've just been putting it, getting the ball moving on that. But basically the community information exchange would be a big database where we could put clients' information in and share it amongst other agencies and organizations to help get them referrals to certain places. So it would be more efficient than people just having to email different organizations and fish for that information. And they wouldn't have to continually keep re-explaining their traumatic experiences as well. So that would be a great success if we are able to do that. It's still a lot of work to be done on that, and we're still, in the baby step stages, but it is good if we continue to move forward with that. So I don't know.
Thank you, Larson. Yeah.
Anybody want to add anything or anything like that?
Larson, how can people access? How can the community access the Hero database right now? What are the steps? How do they get information right now from the Hero database?
Well, you could go to Google and you type in Hero Help Me, and it should be the first link at the top, and you click on that, and they have different categories of if you're looking for food or food pantries. There is breastfeeding information being implemented into there. I just had a meeting with Miss Ella Williamson, and she's putting that breastfeeding information in there right now. There's also other categories. I can't remember what some of the other categories are, but it's pretty simple once you get in there. And they also have there is a PDF in the Hero Help Me database that also explains how you can navigate it and make it easier for you.
Great. Okay.
Thanks
Hey,
for
Larson. Sorry.
Go ahead,
Hey,
Michelle.
Larson, is Ms. Ella still offering training to people, to organizations that want to spend a little bit more time learning how to navigate and how to teach navigation of this Hero Help Me database?
Mm-hmm. Yeah, she is still offering trainings. I think when we talked to her, she was telling us about just training people over the phone or people that called in that has questions. She answers any questions that they have as well. So, and then Armand and I are also working on reaching out to other organizations to do training sessions on Hero Help Me. So we're going to really push forward on that too as well.
Larson, what are a couple of those organizations that are already on the books?
Parent University was one that was on that we're really pushing forward first. And we were supposed to do another training. Armand, can you help me refresh my memory with?
Yeah, not too long ago, we actually did a quick little training with a representative from Savannah State University.
Oh yeah,
Really
Savannah
cool.
State. Yeah. I should have had that one. That was dropped the ball on that one. Wow.
So hopefully we could get more students using the Hero Help Me database. I think that'd be awesome.
Mm-hmm.
Awesome. All right. Well, if we're going to make our 30-minute mark, we're going to go ahead and move on. But excellent questions, great input, and everything like that. And I also learned something new on here I can actually go to see the comments. And so Shante Gatson also gave us a shout out this morning, and she is one of our key partners, key stakeholders with breastfeeding, and has a company called Glow Lactation. And she is doing some really amazing work regarding helping moms understand the value of breastfeeding their babies. So thank you, Shante. We're excited to have you join us this morning. So with that, I'm going to pass it right on over to Nichelle and Elsie and the COVID flu strategy.
You go right ahead, Dr. Smalls.
Good morning, everyone. Again, it's a great to be here and to hear from all my other colleagues. And what we're finding out, of course, which we already knew going into this, all of this connects. And the main, as we talked about COVID and flu, we know that's a big item on everyone's agenda. We see news clips every day about what's going on and how things are changing in the moment. And as we talked about strategies, we had a great team conversation that included Marjorie from Carriage Trade and Dr. Dowse from JC Lewis and Michelle and myself and Tiffany from Epic Health. And we talked about what success would look like for the COVID flu work in the COVID flu space as we move forward. And one of the things that we're already doing, and we know that this is key to our success, not just as an organization, but as a community and as a people, as we move the needle forward in terms of COVID flu information, access, awareness, and understanding. And that is about community engagement. We've, as a foundation of the work we've done in this space, having community listening sessions has been one of our key approaches. We've done 4 so far. We have another one coming up near the end of this month. And we have had conversations to hear from community people about what their experiences have been like, what their perspectives have been like, what they want us to know that we don't know about how to do this work and to do it effectively and with a eye towards sustainability. So again, maximizing that community engagement piece that we've already started by asking folks to come to the table and have a conversation with us and hear what's going on in the community. What's the word on the street? What's the word on the street? Because, sometimes we sitting in our offices or in our spaces and doing our thing, but we can't be everywhere. We can't be at all the churches. We can't be at all the corner stores. We can't be at the barbershops and the beauty shops where the real conversations are happening. And so those the opportunity to have those conversations helps us to do our work and do it well. And another piece in that space is recognizing that as things change from day to day, from moment to moment, from a national, regional, local level, that sometimes there's a perception that the messages are mixed because things are changing so rapidly. And so we have to take a position and understanding that one of the key things that will help us be successful is helping to sort through the different messages that are coming through and finding a voice and the words and the right kind of way to communicate what those messages really mean. That it may seem like it's mixed or changing, but it just means that because things are changing, we have to adjust and we have to put that information out there. So that will be key to our success in making sure that we can help all of our community members sort through the national, local, and regional information that's coming out and then sending it down to the community level. And one last piece I think I would like to emphasize is that our conversation around the value of good, solid, mindful, honoring public relations in this area. That working with a public relation team, which we have been blessed to do, and getting the messages out is so important. So you have to have a public relation team that helps you to convey your message once you get it from the people, and then getting it out into a format and into a forum that helps to spread it even wider. So those were the key things that we think will help us to continue the work that we started and to maximize success as we go into year 4.
Wow, Elsie, that just gives me chill bumps, everything you just said. I'm just going to say that straight out. Not that everybody else didn't, but anyway, just thank you. Michelle, any want to add on there?
Sure. Dr. Small, we covered it like a blanket as usual. And we were in a conversation, the group of us that could still be going on right now. We were getting so much rich information and insight from everyone. And in addition to what Dr. Smalls said, I just wanted to emphasize that we're working. I think we're working on a communication model that hasn't really been used in this area. And that what we have done community outreach, but and we and other organizations have. But the fact that we are taking some serious time to do it. Others may look at it as kind of like navel gazing and all that, but this is vital information. We need to know what that navel looks like.
Yes.
This is vital information that we need if our messages are going to be received. I think in many cases, the message gets thrown out there and it's not received. And then the sender says, well, I don't know what's going on. We gave them the information. What more can we do? Well, what we can do is listen. And what we have been doing, and what I've been learning, from it, we all have been learning from for the last several months, has been key to what we have been, what our work is not just in COVID and flu, but in all of the strategies. And one of the things I'll just add is that in addition to talking to the communities we serve, we also want to engage in year 4 the healthcare community, which is not something we've done a whole bunch of in the past. And that's pharmacists and physicians and physician assistants and nurses, because they are key. And we, just as we are listening, we hope to show them, look, imagine what will happen if you listen to folks and they feel heard. Imagine how much more receptive folks may be to the information that they are getting from outside if they speak to someone close to them and trusted about their qualms or questions about either the flu or the COVID vaccine.
Excellent point. Team, you have any questions or comments for Elsie and Nichelle?
One of the things that popped up because of what you suggested earlier, Nichelle, was the sort of pop-up vaccination clinics. What does that process look like? What if an organization or a company wanted to do their own? How would they go about doing something like that?
Mm-hmm. Well, I'm sure there are several different ways, but what we tend to do is first call Dr. Doust at J.C. Lewis. And if they aren't able to accommodate, then there's the organization called CORE, and of course there is the Chatham County Health Department, and so then you come up with an idea of where that should be, and if there should be pre-registration, which is, I think here lately there's less and less pre-registration. They're accepting. They've always accepted walk-ups, but now I think pre-registration is less and less a thing. So I would just reach out to any of those 3 organizations or others to get the
or whoever's listening could reach out to you too, or Dr. Smalls, right?
Mm-hmm. Absolutely.
All right.
Absolutely.
So just so any of those listening right here know, the email for Nichelle and Elsie is just their first name with @healthysavannah.org, and it's the same for Ashley and Larson. However, Armand and Ruby have different email addresses because this is a partnership with the YMCA, but it's just their full name with a period in the middle, armand.turner@ymcaofcoastalgeorgia.org and ruby.hallam@ymcaofcoastalgeorgia.org. So that's the contact information. But yes, pop-up clinics have been very successful across the entire county and beyond. And so great question, Armand. And I see that we've just got a short time left, but and I know that we have Dr. Smalls and Nichelle have another place to be by 10, so they're going to have to get off. So if you miss seeing them, anyway, great job, you two. And looking forward to what year 4 is bringing with us with awareness, acceptance. And I know there's another A in there that I always struggle with bringing in: awareness, acceptance, and
access.
Thank you.
You got it the first time.
See what I mean? It's like I can't remember 3 A's at the same time. So, but here's what I'm going to do. I'm going to do a segue because the next person we're going to hear from is Ashley, and we're going to talk about then, because what you heard everyone really talk about was community engagement, and Healthy Savannah has been doing community engagement and listening for a very long time, just not as concentrated in these listening sessions like Nichelle and Elsie have been doing that have been just very, very fruitful. But we've done some of that, but not 100%. But we've been listening, and to that end, clearly the communications, and Elsie also talked about a great PR team, and we do have a great PR team. And so if you could Ashley, just want to take off from there and kind of talk about what year 4 brings relative to communications relative to the racial and ethnic approaches to community health grant. And Larson, you two team up together, Ashley. So Larson, feel free to chime in as well, but I'm going to toss it to Ashley for the final section, and then we'll wrap this up.
So the most important thing I want people to take away from this is that we are approaching year 4, our communications via social media, our newsletter, and our website. And I apologize in advance because my dog outside is yelling, barking very loudly. He's upset now because I've ignored him for 30 minutes. So the biggest thing that we want to take away, though, is that we want the front-facing Healthy Savannah voice to be a positive yet informed one. We want people to know about the work that we're doing and the importance of the health issues and inequities that we are addressing, but we don't want people to walk away upset or angry or frustrated or feeling this sort of sense of futility when they read these things, because a lot of the work that we do is very heavy and it can be a little bit burdensome on people who are both sending and receiving the messages. And so the face that we want to put forward is one of positivity. Yes, all of these things are happening, they're real, they exist, but here is a way that we can let you know that we are working on it, that you can work on it too. We want people to come away with like a call to action, something that they can do on their own to improve their own health or their own community's health. And we have working with Carriage Trade PR is a really amazing thing, as well as our very small team that we have here. But Larson and I and Paula work really closely together to make sure that we are communicating our messages effectively. And we're going to see more interaction with our other departments this year. So working closely with Armand, Ruby, Nichelle, and Elsie to make sure that all of their work is getting communicated as well.
Awesome. That is so cool, Ashley. Really well said. Larson, you want to add anything there?
She actually hit it pretty much on the nose. I was just gonna come back and say, I'm excited to work with those different strategies and different themes throughout the year when we do those communication and social media posts. So I feel like that would be a good stepping stone in the right direction, and it'll get people thinking about certain times of the year, and correlating those strategies within the times of the year, and people will start doing it and knowing about Healthy Savannah.
There you go. So one of the things, I'll just put this out there, is so you've seen our website, healthysavannah.org, scrolling across the bottom, and it's easy to find on, if you just do a Google search. And the other part of it is that up there in the upper right corner, you will see we're pretty heavily engaged in the Facebook arena and Instagram right now, especially with COVID and flu work. And the other part is that, see what else is on there? Twitter. We don't do so much on Twitter. I'm just going to call it out as it is right now. But Facebook and Instagram, you'll find us a lot. So please do like us and follow us and all those things that you do on social media, because that's where you're going to learn about updates. You can take our community survey, sign up for our newsletter, all those things that will keep you informed and keep you engaged in this forward-thinking work that we're doing. It's all about, we're trying to have the healthy choice be the easy choice for everyone in our community, regardless of their race, their ability, their age, their income level, or their neighborhood. And we are really excited about what year 4 is doing. I think what Armand said earlier, quoting Laura, is about that this year 4 is. It's going to, we've got 3 years behind us, and we've got this. We've got to keep going, but we can't do it without you guys and that are watching this, and the entire community. We absolutely need your insight, your input, your support, all of the things that go with keeping this, what we call a social movement towards a healthier choice, going. We're 14 years strong right now, and we'd love to put ourselves out of a job eventually, but we know we've got a lot of work to do. But as you see, we've got a great team that's here ready to do it. And with that, anybody have any last comments before we sign off here? Ruby, Larson, no, everybody's good. So thanks everybody for listening, and we'll see you next time. Thanks again. Bye.